I'm Stephan Tolan, one of the sports medicine surgeons with the Steadman Hawkins Clinic of the Carolinas, part of the Greenville Hospital System University Medical Center. Today I wanted to talk to you about cortisone injections. There are a lot of injuries and a lot of diseases of the knee and shoulder and elbow that we use cortisone injections for. Cortisone injection is a very strong or potent anti-inflammatory medicine such as Motrin or Aleve or Naprosyn. The advantage is we can place it directly into the affected area to get a better response from the anti-inflammatory and also to put a higher concentration in the affected area. A lot of people have heard different myths about cortisone injections, that you can only have a certain number in your lifetime or only a certain number in a certain place. Some of it's true, some of it's not. More commonly, we perform cortisone injections in spaces, not directly into tissues. We put them in the space, such as the shoulder. We would put the injection into the space between the rotator cuff and the bone here, so the injection just slides into this fluid-filled space. Other times we can slide it into the shoulder joint from the front, or with the knee, we can slide it into the knee from the side or from the front of the knee. And it's going into a defined space, so it's not really going into a specific tissue. These can be done 2-3 times without really much concern for damaging the tissues. The issue comes up if you've had 1 or 2 injections and things aren't getting better. Then we start looking for other reasons why the shoulder's hurting or the knee is hurting, and that's when an MRI scan may be obtained. Other sites for cortisone injections, such as the biceps in the front or the elbow on the side, those go into the tissues that are affected, and those are the kind that we would not continue to repeat. We like to do one hopefully, and it takes care of it. Sometimes we'll do 2 or 3. Beyond that, the cortisone can cause some local effects, such as depigmentation of the skin, some flattening of the skin or loss of the fatty tissue underneath the skin, and in some areas such as the biceps tendon can weaken the tissue a little bit and may predispose to ruptures. For these reasons, we don't usually put them in areas such as the Achilles tendon or the tendons around the front of the knee to protect these areas. Overall, cortisone injections help us tremendously throughout our offices every day. They also help us diagnose certain injuries and conditions, but more importantly are a quick and simple way to treat many of these conditions. Cortisone is injected into the knee with a small syringe and a small needle. Usually it's mixed with an anesthetic agent such as lidocaine or novocaine, and usually we'll spray the area to be injected with a little topical anesthetic or a topical cold spray to numb the area. So really it's no worse than a regular shot that you would receive at any other physician's office. Sometimes people have some soreness a day or so after the injection. A lot of times that's relieved with anti-inflammatory medications. Allergies occasionally are reported to cortisone, but I think some people feel that what's referred to as a cortisone flare, where they have some increased sensation or they get some generalized flushing from this. Overall, it's something that we use commonly. If it's recommended to you by your surgeon, it's something that he feels will help you with minimal risk.
Cold little feel on your hip here. Going through pulses. I put this over that spot there because it helps dry it. Here's the numbing medicine. You're going to feel a stick and a burn here. Stick, burn. A little bit deeper. numbing. Just that. Bring your foot in for me. Paul, remove that 5-pound sandbag. Just remove it. Just a little bit. That's better. That you can't tell from this type of procedure/imaging. The MRI, you'll have a better visualization of the ligaments and tendons that happen. This is the steroid and long-acting anesthetic. Should help you out there. Good coating.